On March 24th, 2019, Dr. Tara Kuther wrote an article titled "The Meaning and Significance of a PsyD." In this article, she explains the major differences between a PhD and a PsyD in psychology. Both of these degrees allow somebody to be a clinical psychologist. However, the curriculums focus on two very separate areas of learning. The PhD focuses on research in psychology, whereas the PsyD focuses on a clinical approach to psychology. So that meaning somebody with a PhD would be more likely to be an educator at a university or somebody who would conduct psychological research on individuals, animals, that sort of thing. Whereas somebody with a PsyD would be more prepared and more able to handle a clinical setting for individuals. In 2019, researchers from the Institute of Padova in Italy, named Stefania Monarini and Alessandro Rossi, conducted a psychological study titled "Assessing Mental Illness Stigma, a Complex Issue." In this study, they sought out to assess how normal individuals interpreted individuals who have mental health disorders. Now, they believed that in approaching people who would normally consider somebody with a mental illness to be stigmatized from a bioethical approach, which means treating the mental illness or teaching somebody that the mental illness is a biological deficiency and not a moral failing of somebody, that there would be a more positive reception of persons with mental illness. However, and very interestingly, when these programs began to inform people that mental illness was more of a biological issue than it was somebody just being bad, there were mixed results from this approach. People had a much stronger adverse reaction to the stigma of a mental health disorder. So people appeared more fearful and more untrustworthy to individuals that had mental health disorders. But conversely, they did believe that these people needed to have greater access to mental health services. And finally, an article written in 2021 by Dr. Britt Littman, who is a practicing psychologist in New York State, wrote an article for New York University's Applied Psychology Department for their online publication of undergraduate studies. In this article, she describes in great detail what her time becoming a psychologist and conducting her practicums was like. She has a quote that is very striking when it comes to how most practitioners approach deaf individuals in psychiatric capacities. The quote says, "With the limited understanding that many Americans have about deafness, it is no wonder that the literature on psychiatric diagnosis of deaf individuals expresses concern about inaccurate diagnosis. In fact, psychiatric disorders, developmental disorders, and intellectual disabilities are overdiagnosed among deaf psychiatric patients." She goes on to explain in this article that there is a massive cultural difference between deaf, hard of hearing, and hearing persons. A lot of times, what a hearing psychologist or psychiatrist would interpret as erratic or as delusional behavior is simply something that is normal culturally for deaf persons.